The ranking member. I'm going to ask about two topics supporting the mental health of our frontline healthcare workers that has been such a challenge in this time, and long COVID. So to Dr. Walensky, I'll address you first. We've talked about this before. The pandemic has taken a huge toll on frontline healthcare workers. This committee has come together in a bipartisan way to help pass the Lorna Breen Healthcare Provider Protection Act. Passed the Senate in August, and it's actually being marked up in the House today, the Health Subcommittee. I'm happy about that. We're proud to have worked together with folks in this body to get $140 million of funding for this initiative in the American Rescue Plan. Dr. Walensky, we worked closely with Dr. Breen's family for over a year to build support for the work, introduce the legislation, get funding in the American Rescue Plan, and we're encouraged by progress that's being made on this bipartisan initiative. As the CDC works to implement this bill and use these funds to promote education and awareness campaigns, what can those of us who have worked on this bill, who care very much about this issue, do to help the CDC effectively communicate with our frontline healthcare workers that there are resources and help available for them?
Thank you so much, Senator Kaine, and thank you so much for your leadership in this very much needed bill and these resources. First, let me just give you a sense of the scope of the challenges and the problems that we face. CDC published an MMWR several weeks ago, not just in healthcare, but also in our public health workforce. Half of the people surveyed had more than one mental health challenge in the year prior. A third reported depression, a third reported anxiety. 8% of our public health workforce reported suicidal ideation in the past year. When we talk about our healthcare workers, yes, we're hearing about our places that are stressed with COVID surges, but we're not hearing about our healthcare workers who are left after those surges, who are taking care of people where amputations are higher rates than we've ever had before, missed cancer diagnoses because of missed care. This is what is impacting our healthcare workers, and these resources are now, some of these resources are now with NIOSH so that we can provide them for mental health, for resources for support, to research what it is that they need so that we can provide this healthcare workforce as well as our public health workforce the resources that they desperately need. I'm very grateful. Thank you.
Thank you. Dr. Fauci, on long COVID, I've had COVID and I'm still dealing with nerve tingling issues, 18 months after having had it. They're mild, thank goodness, but others who are dealing with long COVID effects, they aren't so mild. Fatigue, respiratory, cardiac, other issues. What updates can you provide about NIH research on efforts to better understand the symptoms of long COVID and how to expand treatment options for patients who have this condition?
Yes, thank you very much for that question, Senator. This is a very important problem which we take very seriously at NIH. Since our last hearing, when you also brought up that very important question, we have now in full implementation of a program called RECOVER program, which is about a $1.5 billion program looking at the formation of large cohorts of individuals to be able to study them from the standpoint of the incidence, the prevalence, and importantly, what the pathogenic mechanisms of symptoms such as your tingling, but even as you mentioned correctly, so many people have much more severe in the sense of almost incapacitating fatigue, sleep abnormalities, a variety of other things. There's 3 components to the program that we've just recently awarded. One is a significant amount of resources to the NYU Langone Center in New York, which takes the scientific lead for the program. The data collection will be led by Massachusetts General Hospital and Harvard Medical School, and the repository for specimens will be led by Mayo Clinic. Since we last spoke, all 3 of those have now become operable, and hopefully the next time we speak in a situation like this, I'll be able to give you some scientific data that resulted from those studies. Thank you.
Thank you very much for that answer. I yield back, Chair Murray.
Senator Paul.
Dr. Fauci, I don't expect you today to admit that you approved of NIH funding for gain-of-function research in Wuhan